Hey guys, I did this last week, and I think probably the most response I've gotten to any video I've ever done was the one that I did looking at some of the COVID numbers and what does that mean and how does that inform my decision making. And I'll tell you what, I got a lot of feedback, a lot of positive feedback, and a lot of questions, which was good because that caused me to do a little bit more reading, a little bit more digging, and to find out even some more information. And so I thought I'd share with you, maybe this is going to become a weekly segment of Andy's COVID analysis each week. This one might be a little bit longer because I'm going to give you some additional information beyond just what the numbers are telling us, and then maybe give you a little bit of feedback as to what are some of the other factors that come in terms of my decision making and day to day how I live my life, but then also in terms of thinking about youth ministry and opening things up and all of the things that go with that. And so first, let's take a look at what some of the numbers are. And we'll do this the same way we did last week. Today, obviously, is August 31st. So if you're watching this and it is nowhere near August 31st, ignore this because the numbers you see are current today. But again, this is one of those things where the numbers are going to keep changing over time. And so they may look very different in a few weeks as to what they look at today. Now, one of the things that I stopped doing a long time ago is trying to predict what's going to happen in the future because even though I never really publicly would say, well, hey, this is what I think is going to happen, there have been times throughout this whole thing as we go back to March and then as different things would go up and down, I would look at it and I'd say, well, it looks to me like this is where things are headed and this is the trend, and then I'd be wrong. And so and the other thing I found is that a lot of the so-called experts that had all these, well, this is what's going to happen and we're expecting to see this, well, a lot of those numbers didn't really seem to come true either. And so rather than trying to predict the future, I'm looking at and saying, hey, what are the numbers? What is the things we know as of today? And how can we look at what's going on today in order to give us the ability to make decisions and make plans, knowing that, hey, if we monitor these things, if they do change, we would then need to reevaluate things. But here's what things look like today. So far, since March, when these things began to be counted here in Illinois, there have been 8,019 deaths in the state of Illinois. Now, of those, as I kind of pointed out last time, of those deaths, 6,920 of those are people above the age of 60. And so the percentage actually is exactly the same as what it was a week ago, that we're still looking at about 86% of those who are dying from COVID-related things are over the age of 60. And so we have this vulnerable population of those who are older, and that we need to think about how do we, in a sensible way, protect those people. But what that also tells us is that we have a large percentage of the population for which this is not a life-threatening disease. And so here's the numbers, and they look exactly the same as they did a week ago, with one exception, and that is, for those who are, let me just explain these numbers again. For those who are over 80, if you get coronavirus, if you test positive for coronavirus, what percentage of those end in death, right? That's the question, because there's a lot of other things that we could look at and say, well, I've had somebody with COVID and, well, I had flu-like symptoms or I had allergy-like symptoms. You know what? Those are not really what we're afraid of, right? We don't shut things down because of flu-like symptoms. We shut them down because of fear of death. And so as we look at this, we say, okay, look, if you are over the age of 80, 29% of those positive cases end in death. And so that is a really serious, significant thing, that nearly 1 in 3 people who are over the age of 80, who test positive for coronavirus, will have that end in death. And so we need to figure out how do we protect those people. But then as we go down the list, one of the things we see is that those numbers drop off very quickly. In fact, those in their 70s. And when I ran the numbers this time, the percentage has actually gone down. And so that's becoming even more survivable than it was before. And then 6%, 2%, on down, until you get down to the youngest group, those under the age of 20, where it's 0.02%. That would be 2 people out of every 10,000 people that test positive. And so that's a very minimal number. And that's one of those things that we have to look at and say, okay, wait a minute. It doesn't seem to have a huge impact when we get down to the lower numbers. Now, here's another thing that I wanted to just sort of bring out in that. Where does this number come from? Well, so far in the state of Illinois since March, so since this has started getting counted, there have been 6 people in the state of Illinois who have been under the age of 20 who have died from coronavirus, out of 25,975 who have tested positive, right? And so I want to just draw that out and say, as we think about particularly things related to children, particularly related to youth, in the state of Illinois, there have only been 6 deaths since March that have been coronavirus related. Now, that's a pretty small number when you consider that we live in a state of 12.7 million. Obviously, you don't want to say anybody's dying, but 6 people out of that many is a really minimal, small number. Now, you add to this discussion the numbers that came out this week from the CDC. And the CDC came out with their numbers related to comorbidity. What that has to do with is the number of people who, having died from COVID-related things, also have another cause of death listed on their death certificate. So, for instance, they died of COVID, but they also had other things that contributed to it. And what they found is that 94% of COVID deaths nationwide have some other underlying contributing factor that caused the death. So it wasn't COVID alone, it was COVID on top of pneumonia, on top of a heart condition, on top of some other condition, and that is what ultimately caused that. Now, here's the thing. You look at that and you say, well, there's a whole lot of people that have something, but what they found was that on average, there was 2.6 comorbidities listed. The average person who dies of COVID also has 2 to 3 other major health issues that are going on there, right? And so suddenly what we're seeing is that for the average person, for a generally healthy person, even somebody who has a regular sort of illness, the idea that coronavirus is fatal is very minimal, very minimal. And so one of the things we're seeing is that this virus is not nearly as harmful as what it was originally sort of thought that it could be. Now, again, we'll look again at LaSalle County cases. So if you are outside of Illinois or if you're not in the LaSalle County area, these numbers won't mean anything to you, but maybe you can go and look them up and see what they look like in your area. In LaSalle County, so far, there have been 1,237 cases. Now, that's not current active cases. That's total number of cases since March, total number of positive tests over the past several months. We get 1,235, which works out to be about 1% of the population of LaSalle County. And that is among the higher ones when we look at the surrounding counties around LaSalle County. We've had 45 people in LaSalle County that have died, which is 0.04% of our population, which actually is the highest percentage of any of the counties surrounding us. And so, I look at that and I say, that's a really low number, 0.04%, but yet that's the highest death rate of any county surrounding us. And so, again, it doesn't seem like it's a very significant thing to me. Testing in LaSalle County continues to be high. We're actually now tested 21% of people. Now, I don't know if that accounts for people who have been tested twice or more than twice because of their jobs or things where they need to be regularly tested. And so that number may be lower than that, but that's the number that's actually reported on the Illinois Department of Health website. Now, as far as the state of Illinois testing right now, we're testing just looking at this past week's numbers because those are really the only ones that really matter. This past week, we've tested about 45,000 people a day. which is actually down from where it was even last week and the week before. And you say, well, how come we're testing less people? And my assumption, I don't have data to back this up, but my assumption is that most people get tested because they're showing symptoms, because they go into the hospital, or that. And so hopefully what this means is that there have been fewer people who have been reporting symptoms, fewer people that are getting tested. And we still see about 2,000 people a day that are testing positive, but that number is actually, whereas last week I said around 2,000, it was actually a little bit more than that. This week it's actually a little bit less than that. And it's interesting if you watch the curve of the coronavirus on if you look at the charts on the Illinois Department of Health website, what you see is that around the end of June, the numbers started to go up and the graph has been going up. And then the last few weeks, it sort of leveled off, and now we're actually starting to see it decrease. Now, doesn't mean it's going to stay on the downward trajectory. I mean, it could change again. But as of right now, if we just look at the data that's there, we have to say, you know what? It seems like we've ridden the wave and that we're now on the downward slope of that. And hopefully that's going to be true. Obviously, I have no way to predict the future. It may pick back up again. But at this moment in time, we're seeing a downward trajectory as we look at the past week. And we are still seeing about 15 to 20 people per day in Illinois of deaths reported related to COVID. And that, you know, I know last week I said, well, that's continuing to decrease, but the reality is it sort of has decreased to that, and it's sort of been in that range for a little while now. And so I'd say we're kind of, that sort of is where we're landing out at this point. And so while it is, we can say, well, it is slightly decreasing, and given enough time, hopefully it will go down to zero. But that's where it seems to be as of right now. Now, if we look at just our surrounding area, and surrounding area, I mean Oglesby, LaSalle, Peru, but then I also looked at other communities that we are most likely to come in contact with. So Mendota, Ottawa, you know, Spring Valley, you know, all of the surrounding Putnam County, people that we are going to come in contact with on a regular basis. There have been 1,817 cases. Now, again, that's not 1,817 as of today. That's 1,817 positive cases since March in our area. And when you look at the population of the areas that I've included in this total, it comes out to about 1%. And that, you know, the change from last week to this week has really been insignificant. It was 1% last week, it's 1% this week. And so, yeah, there have been a few more cases over the past week, but it's not growing at any kind of a large rate. And so I think that's fairly significant as we look at and think about the coronavirus and what that looks like number-wise. Now, let me just give you some other things that I've kind of found this week. And at this point, if you're bored of hearing about coronavirus, feel free to jump off. But here's some things that I've done in sort of doing some research. I've been asked about, well, you know, how does it spread, you know, in terms of thinking about particularly restarting up youth ministry activities, doing things here at the church. What about cleaning? What about keeping things sanitary? All of those kind of things. Well, a while back, the National Institute of Health did some research on coronavirus, and here's what they found. And this is a quote from their website, from the National Institute of Health. It says that the coronavirus is detectable in aerosols for up to 3 hours, up to 4 hours on copper, up to 24 hours on cardboard, and up to 2 to 3 days on plastic and stainless steel. So they looked at coronavirus and they said, look, when it's on a surface, how long is it there? And these are the numbers they've come up with. That's somewhere between, you know, a few hours and 3 days is kind of the lifespan of coronavirus on a surface, right? That's what becomes significant there. The CDC has an article entitled, quote, How It Spreads. And in there, here's a few of the quotes from that. And I'm just going to give you straight quotes from the article. I'm not giving you the whole thing because there's a whole bunch of information there that you can kind of seek out if you're looking for that. But regarding the spread of coronavirus, it says this. It says, quote, information from the ongoing COVID pandemic suggests that this virus is spread more efficiently than influenza, but not as efficiently as measles, which is highly contagious. So what we have is a disease that is slightly more contagious than the flu, but is not as highly contagious as things like the measles. On surfaces, it says, quote, it may be possible for a person to get COVID by touching a surface or object that has the virus on it, and then touching his own mouth, nose, or possibly eyes. This is not thought to be the main way the virus spreads. And we'll come back to that because that's going to come up in several of the articles that I read that I'll share with you. Regarding animals, it says the risk of COVID-19 spreading from animals to people is considered low, but it does say it appears that the virus that caused COVID-19 can spread from people to animals. So you can give this to your pet, but your pet is not going to be giving it to you. And how do we prevent the spread? One of the things related particularly to viruses on surfaces says, routinely clean and disinfect frequently touched surfaces. That's sort of a no-brainer on that one. But Houston Methodist, which is one of the big research hospitals in Texas, has an article entitled, How Long Can Coronavirus Survive on Surfaces? And it gets into a lot of detail, but here's some of what the article says. It says, quote, there's no one-size-fits-all answer to how long viruses can live on surfaces. A lot of factors come into play. The type of surface the virus lands on, the amount of virus that gets deposited on the surface, and external factors such as temperature and humidity also affect surface survivability of viruses. And it goes on to talk a little bit about different examples of how long different viruses will live in different environments. Goes on, it says, depending on the surface, the virus can live on surfaces for a few hours up to several days. The new coronavirus seems to be able to survive the longest on plastic and stainless steel, potentially as long as 3 days on these surfaces. But while surface-to-person transmission of the new coronavirus is definitely possible, the likelihood sharply decreases with time. The same laboratory study also found that the virus degrades relatively rapidly on surfaces, as quickly as just a few hours in some cases. In fact, at the end of the 3-day mark, less than 0.1% of the starting virus material could be detected on plastic. If you touch a contaminated surface, the virus can be transmitted to your hand, where the virus can likely survive for a few hours. The good news is that you can't get infected through your skin. And so if you go through and you read this whole article, the way it sort of spells it out is this. Here's what needs to happen for you to get the virus from a surface. First off, someone who has the virus would need to have sneezed or coughed or in some way gotten enough of the virus particles onto the surface to be able to transmit the virus, which there is a certain degree of those that are needed in order for it to become transmitted. Then in a very short period of time, you would need to come by and touch the very place, assuming that it has not been wiped down. You then have it on your skin where it can live for a few hours, but you can't get it through your skin. And so then you would need to then touch your nose, eyes, or face. There would need to be some way for it to get into your system. And so as you look at that, you start saying, the likelihood that this virus is going to be spread in that way is really minimal when you look at the chain of events that would need to happen in order for that to take place. One of the articles I looked at was from Mayo Clinic on the spread of the COVID-19. And it brings up some interesting things. It talks about as far as food containers and packaging. Here it says this, it says, quote, there is no evidence of anyone contracting the virus that causes COVID-19 after touching food containers and food packaging. It is possible that the new coronavirus might linger on fruits and vegetables that have been handled by a person with the virus. Whether this could make you sick with COVID-19 isn't known. Best practice to wash all fruits and vegetables thoroughly before eating them by running them under water. Soap isn't needed. I don't know about you, but I rinse my produce before I eat it anyway. It's just a good idea. And so the spread of coronavirus that way is really minimal. Regarding surfaces, Mayo Clinic says this. It says, quote, the virus that causes COVID-19 can live up to 4 hours on copper, 24 hours on cardboard, and 3 days on stainless steel and plastic surfaces. So the same as that study we saw before. Regarding water, it says, quote, the virus that causes COVID-19 has not been detected in drinking water. Regarding pets, it says that there have been reports of some pets, including dogs and cats, being infected with the virus that causes COVID-19 after close contact with people who had the virus. Often the animals showed no signs of being sick, and experts don't consider animals to be a significant way that the coronavirus spreads. Regarding insects, it says there's no evidence to suggest that the virus that causes COVID-19 spreads through mosquito or tick bites. Regarding swimming pools, it says there is no evidence that the virus that causes COVID-19 spreads through swimming pools, hot tubs, and water playgrounds. And it goes on to talk about the chlorine in the water killing off the coronavirus. So what does that all mean for us? Well, the CDC also has a article that's out there entitled, quote, Guidance for Cleaning and Disinfecting. And specifically, it's regarding public buildings. And so thinking through, okay, here at the church, what do we need to do to make this place safe for people during the COVID thing? And here's what it says. Just some of the quotes from the article. It says, quote, normal routine cleaning with soap and water will decrease how much the virus is on surfaces and objects. A little bit later, talking about reducing the risk of exposure, it says, quote, coronaviruses on surfaces and objects naturally die within hours. Warmer temperature and exposure to sunlight will reduce the time the virus survives on surfaces and objects. And in that same section, a little bit further down, it makes the point of do not overuse disinfectants. And I think that's something that we need to be aware of, that we can actually be causing harm by doing that. A little bit later, it talks about developing a cleaning plan, and it says most surfaces and objects will just need normal routine cleaning. And then there's a section entitled Determining What Needs to Be Cleaned, and it says, quote, some surfaces only need to be cleaned with soap and water. For example, surfaces and objects that are not frequently touched do not require additional disinfection. Additionally, disinfectants should typically not be applied on items used by children. Many disinfectants are toxic. Cleaning items used by children with soap and water is usually sufficient. And so one of the things we need to be careful of is not to go overboard in our cleaning to the point where we're actually causing people to be sick because of the cleaning supplies that we're using. Regarding outdoors, it says outdoor areas generally require normal routine cleaning but do not require disinfection. Spraying disinfectant outdoors is not an efficient use of disinfectant supplies. It's surprising to me that you have to tell people that. Then he goes on and says, quote, there is no evidence that the virus that causes COVID-19 can spread directly to humans from water in pools, hot tubs, or spas or water play areas. And then regarding less used spaces, it says, quote, if your space has been unoccupied for 7 days or more, it will only need your normal routine cleaning to reopen the area. This is because the virus that causes COVID-19 has not been shown to survive on surfaces longer than this time. And so for us, especially doing things, in the main sanctuary, which we're only in there once a week, there really is minimal chance that the COVID virus is going to survive till the next week. It just doesn't work that way. Now, it goes on and says, quote, it is not necessary to clean ventilation systems other than routine maintenance as part of reducing risk for coronavirus. And then it talks about the idea of setting up a cleaning regimen, which I think any public building probably already has this. And it just says, quote, normal routine cleaning with soap and water alone can reduce the risk of exposure. And so there's not a whole lot of special steps that really are needed here. One of the things that happens here is we do spend a lot of time eating food, and is that a big risk? Well, the CDC also has an article entitled, quote, food safety, right? And what do you need to know? The first title, right at the beginning, there's some bullet points. What you need to know, the first bullet point, quote, the risk of getting sick with COVID-19 from eating or handling food, including frozen food and produce and food packages, is considered very low. And then it has a big, bold heading, and it says, quote, there is no evidence to suggest that handling food or consuming food is associated with COVID-19. And then in that paragraph that follows that, it says, quote, it is possible that a person can get COVID-19 by touching a surface or object, including food or food packaging. that has the virus on it and then touching their own mouth, nose, or possibly their eyes. However, this is not thought to be the main way that the virus spreads. Goes on a little further down to say, quote, currently, there is no evidence that food is associated with spreading the virus that causes COVID-19. Go down a little further. Currently, no cases of COVID-19 have been identified where infection was thought to have occurred by touching food, food packaging, or shopping bags. A little bit further down, it says, quote, although some people who work in food production and processing facilities have gotten COVID-19, there is no evidence of the virus spreading to consumers through the food or packaging that workers in these facilities may have handled. A little bit further down, there's a section in the article on kitchen food safety, and it says, currently, there is no evidence that the virus that causes COVID-19 spreads to people through food. It goes on to say the virus that causes COVID-19 has not been found in drinking water. And a little bit further down, talking about handling food and produce, it says, quote, currently, no cases of COVID-19 have been identified where infection was thought to have occurred through touching food, food packaging, or shopping bags. Then there's a section on meat, poultry, and seafood that says, quote, there is currently no evidence that food can spread the virus that causes COVID-19. And then if you're a hunter, there's another section for you down there that says, quote, there is no evidence that you can get infected with the virus that causes COVID by eating food, including wild hunted game meat. So what do we do with all of this? Well, here's what I take away from all of this. One is that meeting in a building, in general, in terms of coming in contact with surfaces, is not a major concern. The bigger concern seems to be the use of masks, the use of distancing. But in terms of cleaning, as long as you're doing regular cleaning, wiping things up, making sure surfaces are generally clean, which we're doing already, and food is really not an issue, right? These are not ways that the virus is typically spread. And so I think those are all factors that sort of come in when we begin to think about, well, what does it look like to start up again with a ministry season this fall? So let me just take a couple more minutes. I know we're getting close to the half-hour mark, and I'm going to cut it off at that point. But as I think about what are the factors that come into play, first off, let's take a look at what the numbers actually are. Is there actually a major threat here? And the numbers don't seem to show me that there is a major threat from the virus at all. Second issue is, okay, how do we prevent the spread of that virus? Well, wiping down surfaces, washing hands, things like that are just sort of common sense, cleanliness, things that are easy to do that will help to reduce the risk, particularly for people here in the building. And so obviously we want to do those things, right? Food service is really not an issue one way or another, right? And so yes, I know for some people that's a concern. And so that becomes sort of the next piece, right? Is how much are people open to? And so I've been doing just a lot of talking to people, getting feedback from people, and I want your feedback, and I want to know, what are you thinking, what are you feeling, because really that's going to be an important factor as well. But then I think there is a bigger question here, right? And that is, okay, what do these numbers need to say in order for us to determine that, hey, maybe this virus isn't such a big deal. Maybe this isn't something that we need to be so afraid of. And, from what I've seen, the science doesn't seem to justify just shutting down and not doing things. And obviously there's another factor that I take into consideration here. In scripture we read, do not forsake the gathering of yourselves together. And there is something special that happens when God's people gather together. Right, that the whole idea, as we read scripture, so much of it is done in community. When we look at the early church, when we look at Acts 2, where it talks about they had all things together, and just the way they thought, the way they did things, that these believers viewed themselves as part of a community, that they were part of something bigger than themselves. And I think as a church, we need to recognize that there is something special that happens when we gather together for worship on Sunday morning. There is something special that happens when we gather people and put them in a room together, and we begin to open the Word of God and look at that not just individually in different places, but together, praying together, looking at God's word together, and that's something that we are called to do. Now, obviously, if there's a safety issue, we need to think about, is there another way to do that? But to me, we need to look at and say, okay, does the safety issue that's here really justify not doing the things that the Lord has called us to do? And so those are all kind of the things that kind of come into some of my decision making. And if you've managed to make it through this entire long, boring video, good for you. And I'll try to keep it a little bit shorter, maybe if I do another next week update, or maybe if there's other questions that you have that you want me to address in one of these videos, let me know, and I'll try to package it all in there and try to fit it all together.